All right, good morning, and thank you for joining us for the webinar, Teaching Sex Ed, STIs, and Contraception. For your information, all participants' microphones are muted today, but if you have any questions that you would like addressed in this presentation, please use the Q&A box, which you can find in the bottom center of your screen. The chat box, we can talk and discuss if you have any general questions, but if you have any specific questions for Natalia, please use the Q&A box. My name is Savannah Holt. I'm the Sexual and Reproductive Health Program Coordinator with the Saskatchewan Prevention Institute. The Prevention Institute is a provincial nonprofit organization that's located in Saskatoon on Treaty 6 territory in the homeland of the Métis, and we're celebrating our 40th anniversary this year. Our organizational focus is to reduce disabling conditions in children using primary prevention methods. We raise awareness by providing training, information, and resources based on current best evidence. We believe that all children, regardless of ability, have the right to the best physical, social, and emotional health possible. We work in a variety of areas, including sexual and reproductive health, fetal alcohol spectrum disorder prevention, maternal and infant health, early childhood mental health, child injury prevention, child traffic safety, and parenting. One focus of the Sexual and Reproductive Health Program is to provide evidence-based information on sexual and reproductive health that is accessible to health educators and to the youth that they work with. Saskatchewan has high rates of sexually transmitted infections and unintended teen pregnancy, and research shows that age-appropriate comprehensive sexual health education can reduce risky sexual behavior and can increase responsible sexual decision-making. It's important that educators have access to reliable sexual health information and that they feel confident talking with their students about sexual and reproductive health. It is now my sincere pleasure to introduce our speaker for today, who will help us learn more about comprehensive sexual health education, specifically talking about STIs and contraception. Natalia Mason is a sexual health educator and social worker in Saskatoon, Saskatchewan. She holds a BA in psychology from the U of S with a minor in women's and gender studies and a Bachelor of Social Work from the U of R. Natalia also recently completed a postgraduate certificate in sexual health at the U of A. She is currently completing a master's degree in women's gender and sexuality studies at the U of S, and her graduate work focuses on reducing social and emotional barriers to condom use for adolescent girls. Natalia is extremely passionate about sexual health, and she currently works as the Education and Outreach Coordinator at Saskatoon Sexual Health. She's a lifelong member of the Girl Guides of Canada and is dedicated to social justice and reproductive rights for women and girls. Welcome, Natalia.
Thanks, Savannah. You know, I always put everything into my bios because people always ask, like, how do you become a sex educator? What is the job training path for that? And I always say that it's really complicated and it wasn't any one thing specifically. So thanks for reading all of that out. I am also on Treaty 6 territory this morning in the homeland of the Métis Nation. Our office is actually located in Riversdale in Saskatoon, which is a really fun and vibrant community to be a part of. And so I'm super happy to be joining you all today. I'm going to get my screen up here. I want this one. Okay. Okay, screen's looking good there, Savannah. So I'm super excited to be talking to you all today about STIs and contraceptives. And part of the reason for that is that I'm going to be showing you a bunch of new resources that Saskatoon Sexual Health has recently developed to help teachers and other educators deliver this content to their students. So because of the pandemic, we weren't able to go into a lot of classrooms and provide some of the lessons that we had planned for this year. But one of the benefits of that was that we were able to kind of redirect a lot of our energy and our resources into making some resources available. And so that's what I'm showing you today. This is the first time that I'm showing these to people. And so I'm really, really excited. And I look forward to hearing all the feedback that you have. And then at the end of the presentation, we'll also talk about where these resources are available so that you can access them yourselves. And as Savannah said, my name is Natalia Mason. My contact information is here, and I can put that stuff up at the end of the slideshow in case you did want to get in touch. So today I'm going to do a brief intro to Saskatoon sexual health. I'm going to talk to you quickly about what we know about sex ed, talk a little bit about something called comprehensive sexuality education, which is a gold standard in sex ed. And that stuff I'm going to go through, like I said, pretty quickly. And that's just because I know that we've had two prior presentations with the Prevention Institute from Nadine Thornhill and Salima Noon on sex ed. So hopefully some of that stuff is just going to be just a refresher or a reminder for people. We'll talk quickly about the Saskatchewan Health Education Curriculum, and so what students in Saskatchewan are currently required to learn when we're talking about the topic of sexual health specifically. Then we're going to take a look at the sexually transmitted infections presentation, the contraceptives presentation, and then I'll talk to you about other resources that you might want to use. So Saskatoon Sexual Health, like I mentioned, we are in Riversdale in Saskatoon at 213 Avenue C South. We are in a new office space. We moved in January and we're currently sharing space with Out Saskatoon. So we actually have a really beautiful, vibrant rainbow on the front of the building across from the food bank, quite easy to find now. We provide sexual and reproductive health care services with a focus on empowering clinical care and education. We advocate for change within our own organizations and the larger community, working with diverse communities to promote healthy and informed sexualities. So some of the services that are available through Saskatoon Sexual Health, we offer STI testing and pregnancy testing. We offer pregnancy options counseling, and so we can talk about all options, whether or not that's abortion, adoption, or keeping the baby. We also sell low-cost birth control. People don't have to have received their birth control prescription from us. You can bring in outside prescriptions where most people would pay like $35 for the pill. At the pharmacy, our pills could be as cheap as $12 and usually up to about $20. So for people where cost might be a barrier, it's a good option. We also give out free condoms. Our condom delivery has been a little bit challenging with the pandemic as well. So if you're working in a site that would like access to some free condoms, please, please, please get in touch and we can definitely deliver condoms. And when I say condoms, I mean like thousands. If you want 10,000, I wouldn't even bat an eye at that. We also have a PrEP clinic. So when we're talking about STIs, I'll talk to you a little bit about PrEP. But that's a medication that's taken daily to prevent HIV infection. And so we have a dedicated PrEP clinic on Saturdays to help people get access to that medication. We also have emergency contraception, or the Plan B pill, which I'll talk about again later. We offer STI treatment, so anything that we test for, we will also treat. Also really excited about this. I want to say June, we were able to start offering medical abortions in our clinic. That's been a goal for a really, 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 really long time. And so we're really proud to be able to offer that to the community as well. And the last thing there is that we have affordable sex toys. So Saskatoon Sexual Health as an organization is sex positive. That means acknowledging that everyone is a sexual being in one aspect or another. Sometimes kids will say to me, well, what about someone who's asexual? And yes, absolutely. Sometimes people have a sexual identity that's not experiencing any sexual desire at all. That still kind of falls somewhere on a spectrum of human experiences of sexuality. So because we live in a sexualized society, it's likely still going to be something that you're thinking about or experiencing. So these are just good conversations to have with everybody. It also means that we believe that everyone is unique in their sexuality. So what I like and what you like isn't necessarily going to be the same thing, and that's totally okay, as long as we're not hurting anybody, or I normally say at least not without their permission. It also means that sexuality is fluid, so it's something that changes over the course of your life. Who you like and what you like right now is probably not the same thing as who you liked and what you liked when you were 15, or what you'll like once you get older. So we should expect those changes. Also means that sexuality is about more than just sex. Now, today I'm talking to you about STIs and birth control, and that's the stuff that we typically think about when we think about sex ed, but also really important to acknowledge that there are other elements and things worth considering, like healthy relationships, gender equality, power dynamics, when we're having these conversations. Last, that sex can be a positive force. So if it's something that's in people's lives, it should be something that's healthy and safe and makes them feel good about themselves. And then it also means that we believe that everyone has the right to consensual sexual expression, accurate sexual health information. I think that that's really important when we're thinking about these specific topics and making sure that we are providing students and other learners with the accurate information. And the last piece there is to be free from judgment regarding their sexuality. The definition of sex positivity from the International Planned Parenthood Federation, and I really, really love this, says sex positivity is an attitude that celebrates sexuality as an enhancing part of life that brings happiness, energy, and celebration. Sex positive approaches strive to achieve ideal experiences rather than solely working to prevent negative experiences. At the same time, sex positive approaches acknowledge and tackle the various concerns and risks associated with sexuality without reinforcing fear, shame, or taboo of young people's sexuality and gender inequality. So, what do we know about sex ed? Young people want guidance on more than just the birds and the bees or how to put on condoms. And again, today that's kind of what we're talking about, but keeping in mind that there are more conversations outside of STIs and birth control. Sometimes teachers feel nervous or unprepared to teach these subjects, and they move away from simply talking about risks because of what they perceive to be their own lack of knowledge, skills, confidence, or comfort. So obviously, if you haven't been provided the training that's necessary, if you don't feel like you have the information, then these can be really challenging topics to cover. And that's why we are trying to provide as many resources as possible to teachers, because we recognize that it's really hard and we want to make it as easy as possible so that people feel confident. Educators are nervous and hesitant, particularly around conflicting views. So worrying about pushback from parents or from administrators within schools. And that's something that we're working on as well. I'm going to talk to you about some resources that address how you have these conversations with parents and administrators. And I'm also hoping to put together like a letter to send home to parents for these lessons as well too. And then the last piece is that young people want information on healthy relationships from an LGBTQ inclusive perspective. So while you cannot control the relationship choices of your students, you can provide them with the skills to evaluate and make decisions about the kinds of relationships they want in their lives. You can provide skills that will help them cultivate more of the types of friendships they want, while helping them set and communicate boundaries. You can also provide students with information to determine the basic ingredients for healthy relationships. This quote is from a resource that's called Beyond the Basics. It's produced by an organization that's called Action Canada for Sexual Health and Rights. Beyond the Basics is a really big, like 300-page textbook on teaching sexual health education from a human rights framework. It's a really fantastic resource. It is included in some of these resources I'm going to be showing you, and I would definitely recommend it if you're looking to kind of expand what you have available to teach these lessons. All right, so comprehensive sexuality education. CSE is a gold standard, and that is something that's been decided by UNESCO, which is the United Nations. And comprehensive sexuality education is not necessarily something that has been well delivered in Canada or reliably delivered. So we know that in some places, in some communities, young people do get access to really high quality sex ed, but for the most part, it's not something that is super cohesive. Sometimes there are lots of myths about sex ed and what happens when you deliver this material to students. But we know that young people who receive comprehensive sexuality education are significantly less likely to experience unintentional pregnancies than their counterparts who are in abstinence-only programs. Sometimes people think that if you provide sex ed, that young people are going to go out and they're going to have sex sooner and they're going to have sex younger. But that's actually not true. So studies that have been done on comprehensive sexuality education actually show that young people who take classes that are informed this way will wait longer than their peers who are in abstinence-only programs to have those sexual experiences. And when they do have sexual experiences, again, they're less likely to experience some of those negative consequences that we would typically be really focused on. This is just the definition from UNESCO of what comprehensive sexuality education is. So it says, an age-appropriate, culturally relevant approach to teaching about sex and relationships by providing scientifically accurate, realistic, non-judgmental information. The term comprehensive emphasizes an approach to sexuality education that encompasses the full range of information, skills, and values to enable young people to exercise their sexual and reproductive rights and to make decisions about their health and sexuality. I'm going to talk about the CCAN guidelines at the end, so I'm just going to skip over this quote for right now. So Saskatchewan's health curriculum is a bit outdated, and outdated is maybe like an understatement. The health curriculum for most students was last updated in 2009. So that was a really long time ago, more than 10 years ago, and the world has changed significantly. The sexual health curriculum is also currently framed from an abstinence favoring perspective, if you will. So at the beginning of the majority of the health curriculums, there's a quote that says, "Sexual health is a major part of personal health and healthy living. Human sexuality research emphasizes abstinence from all sexual activity involving risk as the best and healthiest decision for adolescents. Research also indicates that students who decide to become sexually active now or in the future need information about effective protection against pregnancy and sexually transmitted infections." And so I do think that that framing is a little bit problematic. That's kind of like saying to a student who's in driver's ed that the safest way to drive a car is to leave it parked in your garage. And we know that that's not how you develop necessary skills. And so I think that there is important room for improvement there when we're having these conversations with our students. Some of the topics that are also missing from the curriculum are things like sex positivity. So it's primarily a sex negative curriculum. The idea of empowerment, of gender equity, diversity and inclusion, accuracy and evidence. I do have some concerns with that, just even the fact that they've indicated that sexual health or human sexuality research emphasizes abstinence. I would be curious to see what research that was. There's a lack of comprehensiveness. There's actually no specific mention of contraceptives in the health curriculum, and there's no conversations around consent. But knowing that those things aren't necessarily present doesn't mean that those aren't values that you can imbue into these lessons when you're teaching. And so I think that that's something to be mindful of, because best practice tells us that those are really important things to cover as well. So just overall, Canada doesn't do as well as we could in terms of outcomes related to sexual health. We still see pretty high STBBI and HIV infection rates, high rates of sexual and gender-based violence, health disparities for the queer community. Comprehensive sex ed is one crucial piece of the puzzle in preventing negative health outcomes. And then, like I mentioned, even though we know that comprehensive sexuality education is best practice, the implementation has been really uneven across the country. And some of you might remember that in 2018, when there was a new government in Ontario, they were threatening to repeal the comprehensive sexuality education curriculum that had kind of been introduced in 2015 and move the students back to the curriculum from 1998. So this is an issue that continues to be contentious and often becomes a platform for political parties to speak to their voter base. The 2018 UNESCO technical guidance defines comprehensive sexuality education in a way that moves past teaching risk avoidance to more empowerment-oriented models. Evidence shows that this improves health outcomes. When we talk about resources at the end, I'll talk about the UNESCO technical guidance, the Canadian guidelines for sexual health education, and how those two things are related, separate but different, and how those have also informed the way that we've developed these lesson plans. This is all particularly relevant for us in Saskatchewan because we fare really poorly with outcomes related to sexual health. We have the highest rate of HIV infection in Canada. It's nearly twice as high as the national average. We also have the highest rate of hepatitis C infection. Both those things tied really closely to intravenous drug use, which is also tied really closely to things like trauma, the impacts of colonization. We have the highest provincial rate of chlamydia infection, the second highest provincial rate of gonorrhea infection. In 2018, we saw a 393% increase in the rates of syphilis over 2017. We have had the highest provincial rate of adolescent pregnancy for the last 10 years. And we also have the second highest provincial rate of sexual violence. So overall, that tells me that we're not doing as good of a job as we could be in delivering some of this content in our classrooms. Okay, so we're gonna switch over now to take a look. So these are resources that we have developed for teachers. These are available on our website. As I'm coming to the end of the presentation, I'll show you exactly where to find them, but these entire slide decks are there and are something that you can use to help deliver this content in your classroom. There's 3 different presentations. Today I'm going to be showing you the sexually transmitted infections, sexually transmitted infections and contraceptives. The 3rd lesson plan is a healthy relationships lesson plan. So students who go through this lesson will learn to understand the difference between various types of sexually transmitted infections. So those infection families being bacterial, parasitic, and viral, and learn about their health outcomes. They're going to understand symptoms, transmission risks, treatments, and prevention for common STIs. They are going to talk about the behavioral options to reduce the risk of STI transmission. They're going to learn about where, when, and how to access testing and treatment for STIs. They're going to understand the social, emotional, and physical impacts of STIs on health and well-being. And they're also going to understand the social and cultural factors associated with STI risk and prevention. All of our lessons start with ground rules to set the tone for the classroom and make sure that it's a safe environment to learn. Going to learn a little bit about sex positivity. I included this at the beginning of each presentation because I think it's also really important for setting the tone and letting students know that we're not here to shame them, that we understand that sexuality is a pretty universal human experience, and that we know that they need this information in order to make decisions that are going to be healthy and right for them. Now, when I'm delivering this lesson, it's typically going to take about an hour. In the lesson plans that are available for these, it indicates how much of a time commitment the lessons are. It might be a little bit quicker for someone like me to deliver this content just because I'm more familiar with it. However, if you were wanting to stretch this over 2 lessons, there would be no problem doing that. There's also lots of activities that are available in the lesson plans, so you can use that to kind of expand the learning opportunities. So here we just have different terms for talking about STIs because sometimes there's a lot of confusion when people say STD, or also in healthcare, we've started saying STBBI now more recently. And so that is all kind of explained on these slides here. If you're curious, the main difference between an STD and an STI, the D standing for sexually transmitted disease, is that diseases typically have symptoms and not all infections have symptoms, and most STIs don't have symptoms. So it's actually more correct to call them an infection than an STD. But that being said, if someone says STD, it means the same thing. They're talking about the same thing as we are when we say STI. Also learning the difference between infections that are curable and infections that are manageable. So some infections, you take your medication like the doctor told you, and it goes away completely. Some infections, you take the medication like the doctor told you, and that helps to address symptoms, but you're still going to have that infection in your system. We also talk about the difference between reportable and non-reportable. And there's a lot of confusion about this in my experience with students. A lot of people think that if you had sex with somebody, you had an STI and you knew it and you didn't tell them, that would be against the law. And that's not actually against the law. There's not a specific set of laws to apply to that. There have been cases in the past where someone has knowingly transmitted HIV to someone else, and those are typically prosecuted using things like sexual assault laws. There's no specific law preventing you from having sex with someone who, knowing that you had an STI. And so we just talk about why those kinds of laws shouldn't exist, because we know they would stop people from getting tested in the first place. And then we learn a little bit more about what happens with the reporting process. So when public health is keeping track of who has tested positive for infections. A lot of this stuff, there's actually tons of parallels between COVID and sexually transmitted infections, because COVID is also a reportable condition. And so we kind of are aware that people are paying attention to like where they've been and who they've come into contact with. And so I think that that's a really fabulous opportunity for us to have these conversations with young people, because now this health literacy has become more a part of our everyday life. So the three different types of STIs are split into three different sections: by bacterial, parasitic, and viral. Now, one of the things that was really typical with sex-negative sexual health lessons was showing students pictures of genitals covered in STIs. And I think that that was partially a scare tactic, but I think that it's also super counterproductive, because what we're going to learn is that the most common symptom for most STIs is no symptoms at all. And so if you teach young people that when they get an STI, it's going to be disgusting, there's going to be bumps and lumps and warts and blood and blisters, then if they're not experiencing those symptoms, they're not going to get tested. And just because you don't have symptoms doesn't mean you have an infection. And I think that that also produces a lot of stigma. So in these slides, we have some really cute animations to talk about the infections, but we're not looking at any pictures of gross genitals or anything like that. The other thing that I would say is that there is this tendency when we're teaching sexual health to expect young people to be experts on all of these different infections. And most people couldn't tell you the difference between the flu and a common cold. So I don't really understand why, when it comes to STIs, we expect everyone to be able to list all of the symptoms and like what it would look like. I think that the most important lesson to press on students is that once you're sexually active, you need to get tested for STIs. You can't tell if someone has an STI by looking at them. You can't tell if you have an STI by looking at yourself. And so testing is the best thing that we can do to take care of ourselves and to protect our partners. But that being said, all of these slides just kind of cover basic information about the STIs, how prevalent they are, and what symptoms might be if we were to experience symptoms. So chlamydia, you can see on the side here that we've indicated infection rates. So in Saskatchewan, we see 543 cases of chlamydia per 100,000 people. Infection rates are always going to be measured per 100,000 people, so we can compare jurisdictions, compare Toronto to Saskatoon. If you looked at young people ages 15 to 24 though, the chlamydia infection rates jump up to more than 3,000 people per 100,000. So chlamydia is really, really common. It's likely something that people will come into contact with at one point in their life. Some symptoms listed there. These are going to be pretty similar for most STIs. They include things like bleeding, pain, discharge, and then also potentially sore throat, cough, swollen lymph nodes, and or fever. And that's because people can end up with a chlamydia infection in their throat. And at the bottom there, you'll see that it says that 50 to 70% of people do not have symptoms. One other thing that I wanted to point out on these slides is that the incredible illustrations have been done for us by Arcana Creative. They did a really fantastic job with all of these things, and they also helped us to develop an STI trading card game that I want to talk to you about at the end as well. So we're super, super stoked about these, about all these slides. It's a really nerdy thing to be excited about, but I'm into it. LGV, chlamydia's ugly stepsister. So LGV is actually just a more aggressive form of chlamydia. The labs in Saskatchewan weren't previously testing for LGV, but that's something that's a little bit more available now. But because it wasn't something that was super commonly tested for, we don't have any infection rates. Symptoms of LGV might include a small painless sore, fever, other flu-like symptoms, or inflammation. Gonorrhea, also known as the clap. So our gonorrhea infection rates in Saskatchewan are 120 cases per 100,000 people. So not as many as chlamydia, but still pretty high, because you'll see that the national infection rate for gonorrhea is 79 cases per 100,000. And some of the symptoms there include pain, bleeding, pain, discharge, swelling. And then syphilis, the pox. So syphilis was one of the only STIs that we were under the national infection rates for, but I think that that's going to change really quickly. Like I mentioned before, we're seeing a really massive increase in syphilis cases in Saskatchewan, so much so that the province is starting to redirect some resources there. And we also have a syphilis campaign that's going to be coming out in the next couple of months. And so it's definitely something to have a conversation about. Syphilis is such an old-timey infection, and so people don't really realize that it's something that is prevalent again now. Syphilis is also known as the pox, no relation to chicken pox. Symptoms of syphilis can include a painless sore on the genitals, anus, or throat. Now, that's the preliminary indicator that someone has a syphilis infection, so that's the thing that you see first. The problem with that is that the sore is usually on the inside of somebody's body, so they might not know what's there. It's painless. And so often people miss that first indicator. In its secondary stage, it'll make you really tired, lethargic. You might experience flu-like symptoms, rashes on the palms of your hands and the soles of your feet, sometimes a full body rash. Syphilis can also cause a lot of issues with pregnancy, which is partially why the province is so concerned about it. It can cause birth defects, preterm labor. It can also eventually cause personality changes, loss of hearing, vision, or memory. At any point in a syphilis infection, people can experience something called neurosyphilis, which can attack your brain function. So that's where some of that personality change, loss of hearing, vision, memory problems come from. So syphilis is a really aggressive infection and something that we don't want people to be exposed to. But the good thing about syphilis is that it is actually curable now. So we treat syphilis using penicillin. Young people always ask me, well, what if you're allergic to penicillin? If you are allergic to penicillin, it is actually such an effective treatment that they will dose you slowly with penicillin until you are able to tolerate the full dose. But a syphilis treatment is 2 giant needles in your butt, so probably not something that you would be striving for. And then Mycoplasma genitalium. I was really excited to update these slides actually because I often say to young people, they'll say, how many STIs are there? And it's kind of a tough question to answer because the only STIs that we know about or talk about are the ones that we can test for. So we didn't really used to have easy screening for LGB, and we also didn't really used to have easy screening for Mycoplasma genitalium, but that's something available now, so I think it's worth talking about. We don't have any infection rates for MG, but some doctors think that it might be the most prevalent STI with over 1,000 cases per 100,000 people. So that's Mycoplasma genitalium and LGV aren't part of a typical STI screen. Usually if someone has been screened and they're not positive for something, but they're experiencing symptoms, then that's when they would test for these secondary infections. Symptoms, again, including vaginal itching, burning, pain, discharge. So to treat for bacterial STIs, and all bacterial STIs are treatable and curable, so you take your medications, they go away. The antibiotics are either taken orally, so a pill, or like I mentioned with syphilis, it is an injection of penicillin. The parasitic STIs, these are the presence of a parasite that's not supposed to be there, so a teeny tiny little microscopic kind of bug. Trichomonas, the symptoms for trick include vaginal itching, pain during sex or when you're peeing, discharge, irritation, a burning sensation. That's what's so challenging about these infections. Sometimes kids come up to me and say like, this is happening to my penis right now. And I'll be like, sorry, I can't help you. I'm not a nurse. But the nurses say that even if someone's describing symptoms to them over the phone or in person, that they can't just guess what's going on. It could be any number of things. And so when people are experiencing symptoms, they just have to come in and do some tests. There's not a lot that we can do to diagnose over the phone. 10 to 50% of people don't have symptoms. The interesting thing about trick is that we can only do a vaginal swab for this infection. So if you don't have a vagina, you won't be able to get tested, but that doesn't mean that you don't still have the infection. So usually you find out from a partner. Pubic lice, this is a classic, a crowd favorite, also known as crabs. every kid just loves to shout crabs. Some of the symptoms: itchiness, dark red dots on your skin, those being the lice, or visible nits or crawling lice. 70% of people don't have symptoms. This was a funny conversation that we had with the nurse because she was saying that it seems like that's a pretty high number, but it's also just likely that the people who do notice that they have the infection are the ones that come in, obviously. Pubic lice can be spread by sharing infected bedding, clothing, and or towels. So the parasitic STIs, as you can see from the slides, are not reportable conditions, so that's why we don't have infection rates for them. The other thing that I think is interesting about crabs is actually because our pubic hair preferences have changed so much lately, that people don't have as many crabs infections. And then scabies. And scabies spreads a lot through non-sexual contact as well, but just important to note that it can spread through sexual contact. And so if you were having sex with somebody and they did have a scabies infection, you should be using a protective barrier. Treatment for parasitic STIs, medical creams or shampoos, antihistamines to reduce itching, and trick is actually treated with an antibiotic. And then the last class of STIs are the viral STBBIs. So I've used that language here intentionally just because we know that hepatitis and HIV in Saskatchewan are specifically more often going to be transmitted by contact with someone's blood. So HIV, or the human immunodeficiency virus, our infection rates in Saskatchewan are 14 cases per 100,000, which is twice as high as the 7 for Canada. Symptoms for HIV listed here: typically mild flu-like symptoms that might disappear after a few weeks after that initial exposure or infection. After that stage, the disease becomes chronic. Most people aren't going to have symptoms in that time. So in that very first stage, that's when you've been exposed to the infection, it's in your body, but if you took an HIV test, you're not going to test positive. It can take up to 3 months for HIV to appear on a blood screen. Then that second stage is the chronic stage, but you're still not experiencing any symptoms at that point in time, and so someone might not realize that they do have HIV. Then the third stage is when HIV turns into AIDS, and all of the negative health implications that are associated with HIV happen during that AIDS infection stage. Now, it is possible for someone to have HIV that turns into AIDS, and then if they start taking their medications, that infection can go back to that secondary stage. So it's really important that people recognize that HIV isn't a death sentence anymore. We have really good medication available for people to manage an HIV infection. When they take that medication appropriately, they have just as long of a life expectancy as any other person. And they're also not going to transmit HIV to anybody else. So that antiretroviral therapy is really, really, really critical in our community approach to HIV and eliminating it as a public health concern. And then hepatitis. So this is funny, I said this to a group the other day. There's 5 kinds of hepatitis, but 2 of them are dog hepatitis. So for humans, we're only worried about 3 kinds of hepatitis. Hepatitis A, not super common in Canada, something that you might think about if you are traveling, usually to like a tropical destination. Hepatitis B is part of our grade 6 vaccine program, so most people should be immune to hepatitis B. That being said, if you're not, you can take the vaccine at any other point in time to get that immunity. Hepatitis C is the one that we're most concerned about in Saskatchewan. Like I said, we've got the highest infection rates in the country for hepatitis C. Hepatitis C, what we see more often is that it spreads through exposure to someone else's blood, and that's usually through intravenous drug use. So with HIV in Saskatchewan, intravenous drug use is about 70% of our infections, and hepatitis C, we're looking at similar rates as well because it's just pretty common for people to be co-infected with hepatitis C and HIV at the same time. The symptoms for hepatitis C include an acute infection, flu-like symptoms, or in chronic infection, we'll see things like depression, weight loss, itchy skin, blood in the vomit. Hepatitis C is the only viral STBBI that can actually be cured. And so that's something that's available to all residents of Saskatchewan. So if someone does have a hepatitis C infection, it can be cured. The only concern is that if they are continuing to use intravenous drugs, that there's a risk of reinfection. And then the last two are herpes and HPV. So HIV and hepatitis are pretty different because we're mostly concerned about exposure to someone else's blood when we talk about those infections in a Saskatchewan context. Herpes and HPV are just two infections that are super common among humans. And I think that outside of HIV, herpes is the thing that freaks people out the most. We get a lot of calls at the clinic about people who've just found out that they have herpes or a partner has herpes. And I think that a lot of that cause for concern comes from the stigma that's associated with herpes. There's two kinds of herpes, oral herpes and genital herpes. They're mutually exchangeable. So you could get a cold sore on your mouth, and if you perform oral sex on someone, you can transfer that infection to their genitals. Like I said, it's really common. So about 70% of adults have herpes simplex 1 or oral herpes, and that's usually what we talk about as being cold sores. And about 20% of adults have herpes simplex 2. And so the symptoms that people experience with that, flu-like symptoms, usually when they just first get the infection, and then the ulcers or the sores that you see. And then the last infection is HPV, or the human papillomavirus. HPV causes genital warts, but it also causes cancer. And so we're really more concerned about the cancer, and that's why there is a vaccine for HPV. The HPV vaccine is now part of the vaccine program for girls born after 2000 girls born after 1996 and boys born after 2006. So right now, but most grade 9 students have been vaccinated against HPV, and that's really fantastic. If someone didn't get the vaccine at school and they're part of the right age cohort, they are eligible to receive that vaccine even as they get older for free. So some of the symptoms that we see with HPV: warts, itchiness, discomfort, bleeding, and then some of those cancers. So cervical cancer, throat cancer, rectal cancer. And the treatments for viral STIs vary, but they include things like antiretroviral therapy, antiviral medications. It depends on the infection. So these are just reminders during the lesson for people to try out some activities. Talking about things like bacterial vaginosis and yeast infections. I'm not going to get into this right now because this is one of my favorite topics and I could talk about it forever, but just good to let people know that there are other infections that you can get that can cause symptoms in your genitals. Talking about testing, who needs to get tested, how will I know when I get tested, how often do I get tested? We usually recommend that people get tested every time they change sexual partners, or every 3 months if they change partners often, or once a year with routine testing if you are sexually active and you're not changing partners. Learning about all of the different treatment options or testing options that are available to us. So the fact that we use urine tests, blood tests, swabs, and visual detection to test for STIs, and if you're sexually active, you should be getting, for sure, the urine, the blood, and the swabs done quite regularly. Learning a little bit more about factors for transmission. In the blood transmission, I always like to take the opportunity to talk to people about tattooing and piercing, and that there's a risk factor there for contracting infections like HIV and hepatitis more specifically. And then taking some time to talk to the students about harm reduction, and so the things that we can do to reduce some of the risks of being sexually active. So I mentioned before talking to them about things like PrEP, which is that daily medication that you can take that is, when it's taken effectively, is 99% effective at preventing HIV transmission from someone who didn't have the infection previously. So that's a really, really important medication that's just become available. And it's actually free of cost for all residents of Saskatchewan. So it's a great option for people if they're considered to be high risk for an HIV infection. And then at the end, taking a minute to talk about stigma and how much of a barrier stigma can be for people getting tested, and that we need to make sure that we're being respectful and not shaming people for being sexually active or for getting tested or being responsible. And then at the end of the lessons, there is just a recap. Okay, I'm going to pop you over to take a look at the contraceptive slides. I'm just going to try to take like 10 minutes to go through these, maybe 15 minutes, we'll see. And then I'll answer some questions for you at the end. So contraceptives, birth control, talking about things that we can do to prevent pregnancy from happening. Understanding the 3 major steps involved in pregnancy. So how does a pregnancy actually come to be? Talking about misconceptions for using birth control, talking about options and emergency contraceptives, talking about which contraceptives prevent both pregnancy and STI transmission, and hint, that is condoms. Identifying the issues with typical use that decrease efficacy, learning how to use condoms, and learning how to decide which birth control option is going to work for us. So those ground rules again, talking about sex positivity again, and then just brainstorming some ideas for what kind of language we use when we're talking about contraceptives. What does that word mean? Is it different than what birth control means? And there's no real difference. One is just kind of a little bit more of a accurate word, if you will. Sometimes people also say stuff like family planning. All of those things are just typically things that help us to prevent an unwanted pregnancy. So there's steps outlined here to talk about the process of pregnancy. I always like to make sure that I take the time to explain how pregnancy happens, because then it helps you to explain how each of the birth control methods actually work. And if young people understand how the birth control is working, what it's doing to their body, or which process it's preventing from happening, then they're more likely to use that method properly. So the process of pregnancy also has a video that explains the process and is something that I've included in the resources for people. So I almost always use that in the lesson plan when I'm teaching birth control. That video is from Planned Parenthood. Doing a pop quiz, talking about what we already know about risk during sex and intimacy. So how we get STIs, how pregnancy happens, things that might be low risk. Also taking some time to learn about hormones. And I think that learning about hormones is really important because it also explains how birth control options work. And it does a little bit of myth busting. I'll often get the question like, what happens if boys take a birth control pill? And the short answer to that is nothing, because we all have all of these hormones in our bodies. I think that it's an interesting opportunity to talk about things like sex testing or genetic testing in sport, talking about people like Caster Semenya, what it means when we have higher levels of one hormone versus another one. And I think that that's an interesting way of including conversations around gender and sex and what the difference is for students. Teaching them how we think critically. So what does it mean for something to be evidence-based? What does that sex positivity mean? And what does harm reduction look like? There's 3 different kinds of birth control. So one's hormonal, so using those hormones, estrogen or progestin, usually as a way of tricking the body into thinking that it's already pregnant. If it's already pregnant, then it's not going to try to produce a competing pregnancy. And so that's one way that it prevents someone from getting pregnant. Things like barrier methods that just physically prevent sperm from getting into the uterus. And then the last option there is non-hormonal methods, specifically being the IUD, because the IUD is not a barrier method and it's not using hormones. It is actually using ions. Learning the difference between perfect use and typical use in terms of efficacy of a medication. So what we can do to make sure that we're using these medications to get the best possible results, but also what the typical results are going to be. And this stuff, because I'm going to be sharing these slides with you later, you can go through them a little bit more closely. I think everything that you need to know to teach this lesson is going to be on the slide. There's not any like secret information that we didn't include on here. So it's all pretty straightforward. So talking about the birth control pill, the fact that the birth control pill is 91% effective with typical use. So what that means is that if you had 100 people using this birth control option, in 1 year, you would see 9 of those people experience an unintentional pregnancy. People often think that the birth control pill is like the best option for birth control, and it's actually not. Of the hormonal options that are available to us, it's one of the worst options. And that's because you have to remember to take your pill at the same time every day. And so there's a lot of room for human error there. And so talking about those kinds of things, efficacy rates with students, helps them to understand what it looks like to commit to one of these options and how they might choose something that maybe would be a better fit for them. And then on the bottom there, you'll see the cost. And so this is the cost for these medications at our clinic, the birth control pill, because there's lots of different options that have different combinations of hormones, et cetera, will cost between $12 and $22 at our clinic. One of the things that I was also going to mention is that we have birth control teaching kits that are available for people to borrow from the office now. We just ask for a $20 deposit. So these birth control kits have one of basically every single birth control option in them. So you can pass those around to students and have them take like an actual close look at some of these options because there's a lot of mystery around how some of these things look or work. The NuvaRing, pretty much the same as the birth control pill in terms of hormones. It just delivers them to the bloodstream differently. It's inserted into the vagina. It stays in there for 3 weeks at a time, and then it comes out for 1 week. Students are always like, how does it get in there? With your fingers. How does it get out of there? Also with your fingers. The NuvaRing costs about 20 bucks at our clinic. And I usually say to them, if you're not comfortable touching your own vagina, then it's a pretty good indicator that you're not ready to let anybody else touch it yet. The Ever patch is a patch that goes onto your skin, looks like a nicotine patch, goes on your arm, on your shoulder, could go on your butt. You get 3 patches in a pack, so you switch locations on your body once a week, and it costs about $20 as well. Depo-Provera is an injection, an intramuscular injection. So that would be something that the nurse or a doctor would do. You get your Depo injections every 3 months, so 4 times a year. They cost $35, which is actually more cost effective than the pill because you don't have to buy it as often. And it's a little bit more effective, 97%. Copper IUDs. So there are 2 kinds of IUDs, copper and hormonal. Copper changes the ionic environment of the uterus, so it just makes it really inhospitable to sperm. It's kind of complicated to explain to students, but it just basically irritates the uterine lining. And it does things like make the sperm's tail fall off, thickens the cervical mucus. IUDs are a pretty old school form of birth control. They've been around for a really long time. Copper IUDs are really effective, which is fantastic, and they're also a non-hormonal option. So for somebody who doesn't want to use hormones, we would always kind of recommend copper IUDs second. They're also pretty affordable. They cost about $75 at our clinic, and some of the copper IUDs actually will last 10 years. You can see the efficacy rate there is just perfect because there's not really any user error with IUDs. The hormonal IUDs use progestin to prevent pregnancy from happening. They last about 3 to 5 years. There's 3 different options that are available to people. 99.9% effective. Again, no typical use rate because there's not really any human error with these guys. They are more expensive. They cost about $400. Most people's health plans will cover hormonal IUDs and copper IUDs. If a health plan won't cover it, we have a way of using people's emergency medication benefit from the province, and I'm happy to answer more questions about how we kind of arrange that at the end. The implant. Super excited about this. The implant is something that's been available in other countries for decades, and has not been something that was available to us as Canadians, but it was just approved by Health Canada and came onto the market in the last couple of months. It's not on the drug formulary yet, which means that no one will have drug coverage for it. So the cost right now, we're looking at about $275. I don't think that we have any in the clinic quite yet, but we're expecting them to show up pretty soon. The implant is the most effective form of birth control that is available. It is also less invasive than an IUD because it's not inserted vaginally into the uterus. It's just inserted into your arm and then it stays there for 3 months. Talking about condoms.
Sorry, Natalia. 3 years. Yep. You said it was in your arm for 3 months. Just correcting there.
Oh, 3 years. Thank you. I don't know if anyone would deal with that poke every 3 months. That seems like a lot. So condoms, what I normally say to students is that condoms are really, really good infection protection. They're not super great birth control. An external condom or a male condom is about 86% effective with typical use. So that leaves a lot of room for failure. But that being said, we love for people to double up. So to use a hormonal method and then a barrier method like condoms at the same time, just to also prevent STI transmission. We give condoms away for free at the clinic. We also have some videos on how to use condoms, and those are on our YouTube page. I just made those in the last month. And so if you're looking for a condom demo video, you can use those. There's also one for female condoms. Female condoms are pretty hard to track down. They're more expensive. They're like $2 a condom, not reusable, and they're less effective. But for some people, it might be a better option. And so good to just talk about it being something that's available as well. So again, we've got some spots to do some activities. In the contraceptives lesson plan, there's activities on talking about birth control with a partner, and learning to kind of navigate some of those conversations. Talking about the do's and don'ts of condoms, how we use them. Talking about lube. I love to talk about lube. There's a slide here for other options of birth control. So this is all stuff that's non-hormonal. Typically not something that I recommend to teenagers because most of these options require a lot of forethought. And some of them just aren't even effective. Like the cervical cap is 40 to 60% effective with typical use. The pull-out method is more effective than that. So I don't really recommend these things for teenagers. But I do think it's cool to just talk about how far reproductive technology has come and that we're fortunate to have the options that we have now. Learning a little bit more about emergency contraceptives. So everything we talked about before were things that happened before you have sex. These are things that you can use after the fact. If there was an accident, you didn't use a condom, whatever else, to help prevent pregnancy from happening. Talking about dental dams, the great mysterious dental dam. Those are used for oral sex on a vulva. Lube again, or things like gloves. And all that stuff is in the teaching kit as well. So you don't have to worry, like scramble to figure out where you're going to get those things. The teaching kits include those. Covering the different places where you can access birth control options. How do I talk to my partner about contraceptives? How do I decide if I'm ready to have sex? Also bringing in that conversation around consent. That's in the Healthy Relationships presentation, lots of consent talk, but it's a worthwhile conversation to have at all of these different steps. And here you'll see that they're talking more specifically about something called stealthing or removing a condom without a partner's knowledge, and just the ways that issues around consent can present themselves. Talking about abstinence. Abstinence is the only 100% effective method of preventing pregnancy. And so I think it's important to talk about that with students because a lot of students will choose to be abstinent. And it's really important that we support those decisions as well as supporting the decision to be sexually active. Different considerations for how we choose contraception options that are right for us. Side effects. Another opportunity to do some activities, and then just a summary of that lesson. So I know that that was like really, really quick, kind of blowing through some of those things. But all of the information about each of the birth control options is on the slide. The same with the STIs. All the information about that STI specifically is on the slide. The other thing that, oh, actually, I think I have them behind here. 1 second. So the other thing that is available with each of these presentation slide decks is a lesson plan. So the lesson plan kind of outlines the lesson. It has the curricular outcomes that are tied to these lessons for teachers who are in Saskatchewan. Goes over the main components, any materials that you're going to need, talking context. Ground rules, a breakdown of what's in the lesson, instructions for an activity, talking about how to do question box. Question box is super, super important for all of these lessons. And then information on the Kahoot quizzes as well. We've got some Kahoot quizzes that you can use to expand on these lessons. And then at the very end, there's all of the appendices, which have different activities for students. So HIV true or false cards. There's lots of activities on here. I can't go through all of them. And what else do I want to show you? So I'll just kind of indicate where these things are available on the website as well. So if you just go to Saskatoon sexualhealth.ca, at the top you'll see a banner that says About Us, Services, Education. If you click on Education, and then you scroll down past Education Program, you'll see resources. And so each of these lessons and the materials that you would need to teach that lesson are under these slides. So you could just click on contraceptives, and then you'll see the lesson plan here. The slide deck is here as a PDF, and then videos that we recommend that you might want to use to support your lesson as well. And I think that that's it for me in terms of what I wanted to show you all today. If anybody has any questions, I would be super happy to answer those.
Natalia, I have a question for you. I just wanted to ask you again about the emergency benefit for IUDs. Could you give us more details about that?
Yes, so each resident of Saskatchewan is afforded something that is basically an emergency prescription. So I think that lots of people think that one day they're just going to be like traveling and then they're going to contract some unknown infection and that the treatment is going to cost like $3,000. And so they want to they save that emergency prescription for that reason. And the fact is that doesn't typically happen. Also, medications that are super, super expensive have a different benefit that will help to cover the cost of them. And so IUDs are actually a really good use of that specific benefit because it's a one-time cost. So with other prescriptions, you need multiple doses. This one is just a one-time cost. It's a pretty expensive, like high cost, $400, but it's something that lasts for a long time. And then the other thing is that you're actually entitled to more than one emergency prescription. So if you did need to access it again in the future, it is something that would still be available. And so when we use that, it brings the cost of an IUD down to about $20. And so we've got a couple pharmacies that we've worked with who are in the habit of doing that for us, and we can definitely provide more information on that option.
Thank you, Natalia. So we have a question. Was Plan B in the contraceptive lesson?
Yes. So Plan B is in the contraceptive lesson under the emergency contraceptives. There's 3 emergency contraceptives that are available. So one is Plan B. That one's kind of like what most people are familiar with. Plan B can be taken up to 3 days after unprotected sex. The sooner you take it, the better it works. We sell it for $16 at our clinic here. One of the downsides, though, of Plan B is that it is counterindicated for some people over a specific BMI. And so depending on how much someone weighs, Plan B becomes less effective. So based on that, people might also want to consider something that's called ELA. Plan B doesn't need a prescription, which means that we're able to offer it at the clinic, or you can get it from the pharmacy over the counter. But you don't need the prescription, so you can just ask the pharmacist for it and they'll give it to you. ELA does require a prescription, which can be kind of challenging, especially because it's time sensitive. But ELA is a good option for people who are over that BMI, or for someone who wants to take it after 3 days, because ELA is actually effective for 5 days. And then the other thing that was indicated as an option there for an emergency contraceptive is a copper IUD, which can actually be used up to 7 days after unprotected sex.
Thank you, Natalia. I have questions about what kind of work SSH is planning to do around syphilis.
So I'm not entirely sure what the campaign is going to look like. We're working with Arcana Creative on that syphilis campaign as well. But that's just going to be a, public awareness campaign. So we should be seeing it on buses and on billboards and that kind of thing, which will be exciting. And then we actually are working with partners at another national organization to do an awareness campaign just on like the importance of testing that's specifically targeted at young people. So within the next few months, hopefully we're going to be noticing a kind of increased presence around that conversation, talking about STIs. One of the things that happened with the pandemic was that the lab had to redirect their resources, and so they stopped accepting samples for chlamydia and for gonorrhea specifically. So our infection rates from like March through June just dropped dramatically. But that didn't mean that those infections were no longer present. It just meant that people weren't getting tested. So now that things are kind of starting to get back to normal, the infection rates are just swinging back upwards really aggressively. So it's important that even though, we're worried about COVID and we're thinking about that we also remember that sexual health in this province is a really big concern. And so access to routine testing and treatment is going to be really, really important.
Thank you, Natalia. We have a comment from Taryn. She says that one thing that stood out to me was how Natalia didn't use gendered language, which is really great for teachers to note. Did you want to speak a little?
Thanks, Taryn. Yeah, so we worked really hard in all of these presentations to make sure that they are gender inclusive. So these aren't lessons that are specifically about gender or about sex, but we know that that's obviously an idea that's been woven through these conversations about birth control and who's using birth control and whatever else. And so if you can get into the habit of talking about, like the body function specifically, talking about the ovaries, and so saying, when the ovaries release an egg instead of saying when a woman ovulates, those are really easy ways for us to kind of make sure that we're being inclusive, but to also flip the switch. And I think that is also really beneficial, because when you say when a woman ovulates, you're not talking about what's happening really specifically there. But when you say when the ovaries release an egg, which is called ovulation, then we see where that egg is coming from and we learn a little bit more about that process. Hi, Flora. So glad that you're here. Yes, the Saskatchewan curriculum is outdated. We've had a conversation with the Ministry of Health and Education about that. I'm not expecting to see any changes right now, which is why we kind of went ahead and made some of these presentations so that teachers have the resources that they need.
Right, we have a couple more questions. How do you handle questions from teens who say they want birth control but can't talk to their parents for help getting it?
It's a super tough question. I think that the most important thing to remember is that a young person gets to make decisions about their life. That being said, we know that, sometimes people live in a parent's home and the parent makes the rules. But at the end of the day, if a young person wants birth control, they get to make that decision for themselves. So they don't need a parent's permission to access birth control, to access testing or treatment. We at the clinic basically function from a perspective being that if a young person is responsible enough, mature enough to get themselves down here, if they understand the medication that they're taking, the procedure that they're consenting to, then they have the right to consent to those things for themselves. And so I do still like to encourage young people to talk to their parents about sex, to talk to them about birth control. If they're sexually active and they're thinking about using birth control, that is the responsible decision. That's the behavior that we want to see. And so ideally, we learn to have those conversations with our parents, but knowing that if the parent was like very opposed to that, at the end of the day, it's still that young person's decision to make about their own body.
All right, another question. How have you talked a bit about PrEP to use preventively for HIV? And could you talk a bit about PEP too?
Yes. So PrEP is a medication that someone would choose to take. And again, because they maybe would be considered high risk for HIV infection. PEP is more of an emergency measure. And so PEP would be something that was taken if, for example, there was a needle stick or they were poked by a needle, picking up garbage in the community, or if a paramedic was exposed to somebody else's blood. Or the other place that we would see PEP being used is in the cases of a sexual assault, if the person didn't know that other person's STI status. So PEP ideally isn't something that like people would be taken super regularly, because PEP has more negative side effects than PrEP does. It's just a little bit more aggressive of a medication. So you wouldn't want to be taking PEP regularly. So if there had been more than one occasion where someone needed to take PEP, then that's probably when the doctor should be having a conversation with them about using PrEP instead. And PEP isn't something that is available at our office. Usually if someone was looking for PEP, we would be sending them to the emergency room.
Thanks, Natalia. We have a comment from Kelsey as well about how contraception can also be used for period control, which is something that people who have uteruses might want to use no matter their identity or sexual choices. She also says, thanks, and that you're so knowledgeable.
Hi, Kels. Yes, and I think that is on the slide about contraception. Like there's a slide on benefits and risks, and so I kind of glossed over it when we were going through each of the options. But absolutely, sometimes people are choosing to use contraceptives for reasons that have nothing to do with sex. So using it because it helps to control things like acne, because it will help make periods more regular, or if somebody had really heavy periods, might help to make the periods lighter. I think that there's also reasons to use birth control for things like PCOS and whatever else. And so birth control isn't always about someone having sex. And that's important for students to recognize too, because I think that there's still even a little bit of stigma around using birth control and what that means, and being sexually active. So good to talk about the reasons that someone might be choosing to use contraceptives. The other thing that I put on this slides here are just some other resources that I will often rely on for developing lesson plans or looking for activities. So I mentioned Action Canada. They're Beyond the Basics curriculum, which is really great. They also have a report that's called The State of Sex Ed in Canada. And that was something that we helped them to collect data on. So they actually came to Saskatoon and did a focus group with young people here. And so sometimes stuff that's done at a national level doesn't really include Saskatchewan. But we are included in that specific report. And so there's information from teachers there, and there's lots of just like feedback from students themselves who had poor sex ed and like what that meant for them in their lives. Pleasure Pie is another really great resource. I think that one's out of Boston in the States. They have lots of great activities and just like cute illustrations. Obviously, the Prevention Institute, we work really closely with the Prevention Institute and have for quite a long time. My favorite thing about their resources is that they will provide them to you free of cost, and they can ship them. I think they charge for shipping, but still a really great way to get resources into the hands of students. I use the contraceptives pamphlet that they have and the healthy relationships booklet that they have all the time. I love giving those to students. CCAN, I don't have the resources in front of me right now, but CCAN produced something called the Canadian Guidelines for Sexual Health Education. Those just came out in 2019, and so they're new, and they're just kind of like, they are, I guess, they're the gold standard for what sex ed should be in Canada. And so I think that that's really useful for when you're trying to advocate either to an administrator or to parents about why you need to be providing this education to students. The other thing I really like about it is that it talks about different sectors and their responsibility in delivering comprehensive sexuality education. So what does it look like for people who work in group homes to deliver these messages? What does it look like for people in schools? What does it look like for people in the justice system and correctional facilities and that kind of thing? So I definitely would recommend reading those over before you're starting to teach your sex ed lessons. Also, the United Nations Population Fund, they've got a really fantastic report that's called Young Persons with Disabilities, acknowledging that young people with disabilities are often excluded from these conversations, or sometimes they are forced into decisions about their reproductive health because of their disability. And so that's like someone forcing them, to get an IUD or to have their tubes tied or whatever else because they don't want them to experience an unintentional pregnancy. And so there's some like human rights violations that happen in those conversations. And so I really recommend checking that out as well, especially if you're working with students with disabilities. And then the United Nations also produces that International Technical Guidance, which is a really, really massive book. Unless you're like a sex ed junkie, you really don't have to worry about that. You can use the CCAN guidelines because the CCAN guidelines are in line with the International Technical Guidance. And then the last piece there is teachingsexualhealth.ca, and that's a resource that's out of Alberta, but they've got lots of like curriculum related content and that kind of thing.
Natalia, I have another question for you. We see a lot of talk, especially on social media, about people getting off of hormonal birth control due to issues that it can cause or has caused their bodies and health. Is it important to provide education on this as well, or do the pros of hormonal birth control outweigh this? Thank you.
I do think that it's important to talk about the side effects of birth control, absolutely, because that's part of making an informed decision. And so it's really important that we explain all those things to students. When I'm in a classroom talking about those things, though, I just remember that I'm not a nurse, I'm not a doctor. And so before someone is prescribed a birth control option, the physician or the nurse practitioner, whoever is prescribing, should be having those conversations with people because some of that stuff is complicated, but I do get lots of questions about it. The other thing that I always remind students is that the most dangerous condition for a woman or someone, with the uterus and ovaries to be in is pregnant. Like pregnancy in and of itself isn't without side effects and symptoms. And so choosing not to use birth control and then getting pregnant is not necessarily a better health outcome for that person without even considering all of the like social outcomes of having a pregnancy before you were ready or when you didn't want to. So I definitely think that talking about those side effects is super important. But also having the conversation around, like how we can monitor those kinds of things and how we can choose options that have fewer side effects. So things like the implant are going to have fewer side effects, or, maybe choosing to use non-hormonal birth control or something like a copper IUD.
Thanks, Natalia. We also have a comment from Taryn in the chat box. She wants to let teachers in Regina know that she also has an STBBI and contraceptive demo rental kits to lend out from Planned Parenthood Regina. They can also offer free condoms.
Yeah, that's so fantastic. And thank you, Taryn, for mentioning that. I would have given you a shout out because we kind of rely on Planned Parenthood Regina to be our partner in the southern part of the province and provide the same resources and services that we provide in Saskatoon and area. If I have a second, Savannah, the one thing that I want to show everybody is these STBBI trading cards because they are the pride and joy of my life, if I can find them. I mean, the other thing that I'm excited about right now is the YouTube page. So follow us on YouTube if people have suggestions of videos that we could do, comments. We would love to get that feedback. I just made the YouTube page like a month ago, and so I'm really excited to make some videos. Okay, share screen. Okay, so this is something that should be available up on the website as well next week. I'm like thrilled with these cards. We worked with Arcana Creative to make an STI like trading card game. So it's kind of like Pokemon, but for STIs. So we are going to print some of these in the office to be available for people. But then there's also a printer-friendly version that you can just print off for your class. And so there's a card for each of the STIs talking about symptoms, how we would detect that kind of an infection. Some of them have fun facts on the bottom. And then there's also, sorry, I'm just gonna keep scrolling here. There's testing options. So like the idea with this game is that you're going for the lowest possible score. Some of the stuff around scoring was kind of hard to figure out because we didn't want it to be like sex negative. We didn't want to say that like HIV was negative 45 and like chlamydia was only negative 3 because for different reasons, different infections are more concerning or less concerning to us. So basically everything is either plus 5 points or minus 5 points. There's things that you can do to lower your score. So getting tested, using condoms, taking PrEP, being vaccinated, using dental dams. So this is something that will be up on the website, I'm pretty sure next week. And I'll let people know when we have the printed versions as well. So I'm really excited to see how this goes in classrooms. I think it's just like one more interactive way of delivering some of that content.
Those look amazing. I'm pretty sure a lot of people are very excited, according to our chat box right now, about getting their hands on those. If we have a couple of minutes as well, we have you returning with Delilah from Saskatoon Sexual Health on November 3rd for a presentation on anti-racist sex ed. Do you want to tell us a little bit more about what people will learn in that session?
Well, that's a good question. Delilah and I haven't made the presentation yet. So I think that there's a lot to be uncovered for what's going to be in that presentation. But we're certainly going to be talking about the current political context. I spent the last couple of days in a gathering of sex ed champions was what it was called, but people who are really excited about sex ed in Canada. And just talking about the ways that sex ed in so many different ways can be transformative, and it teaches young people not only about like their health and their bodies, but also autonomy and relationships and conflict resolution. And so that presentation is going to be about the ways that race has impacted people's sexual and reproductive health in the past, talking about the history of gynecology, talking about things like the syphilis tests in Tuskegee, talking about Puerto Rico and birth control. And then we're going to talk about how we can weave anti-racist education into our sex ed lessons and make sure that that content is being delivered in all aspects of students' learning.
That sounds fantastic. Anything else you'd like to share with us before we wrap things up?
I'm sure that there are a million things that I would like to share, but I will just say that if anyone has any questions about any of this stuff, of course, that you can get in touch with me. My email is on our website. I always love to have feedback on resources or requests for resources. So definitely don't hesitate to get in touch.
Perfect. A reminder to everyone that this webinar was recorded, and I will be following up with a lot of resources and a link to the recording after this is wrapped up, probably in the next couple of days. And another reminder that the Saskatchewan Prevention Institute, as Natalia mentioned, has a lot of free resources for teachers. They are available on our website if you would like to take a look. I will be including links to the most useful resources for sexual health education on the follow-up email. I also want to note that in this series, this Teaching Sex Ed series, I will be giving away a copy of Beyond the Basics. And so after this is done, I will look at the list of people who were able to attend today and randomly choose someone to receive that. So I will be in touch with a lucky winner. If you aren't chosen, make sure that you sign up for future webinars as well. So thank you everyone so much. If you want to be kept in the loop, please send me an email at sholt@skprevention.ca if you would like to be added to the Adolescent Sexual Health Working Group community of practice. And so we can keep you in touch on new resources and learning opportunities in the future. Thank you everyone so much.